Hello and welcome to Spectrum Health's Media COVID-19 briefing. I'm Carrie Manders from the Spectrum Health Marketing Communications Department. I'm joined by my colleague Bruce Rossman this afternoon. We're going to get started with some opening remarks from our President and CEO, Tina Fries-Decker, and then hear from Dr. Daryl Almucci, our President of Spectrum Health West Michigan. We invite you to place any questions that you may have in the chat. And please make sure to identify which media outlet you are from. We will try our best to get to all the questions as our time allows this afternoon. So to get us started, I will turn it over to you, Tina.
Thank you so much, Carrie. Appreciate it. And before we get started, I want to say Happy Veterans Day. We are so appreciative and grateful for all of the veterans and for their service to our country. Today, as Carrie mentioned, we'd like to share with you our current situation with respect to COVID-19. We are facing some of the most daunting and demanding challenges since this pandemic began. COVID-19 is surging across our state, and we are heading in the wrong direction. So I'll give you a few facts. On a daily basis, we conduct about 4,000 tests a day. Today, our positivity rate is approximately 14%, which is similar to the 7-day average. 2 weeks ago, it was 10%, and 2 months ago, it was less than 3%. And our comfort level with a positivity rate is typically around that 3%. We really don't want it any higher than 4 or 5%, because once we see that, we see it start to increase exponentially. We today have just under 300 patients hospitalized in all of Spectrum Health's hospitals. The exact number is about 289. This number has tripled in the last 20 days. It is 3.5 times higher than it was last spring, and it's 8 times higher than just 2 months ago in September, when our positivity rate was below 3%. What we're seeing in our hospitals is that COVID-19 is affecting all groups, young and old, cutting across all populations. We are starting to see more deaths in the last 3 weeks. The mortality rate for those hospitalized with COVID-19 in West Michigan is about 1 in every 10 people. And so that's very concerning. And we also are concerned because this is spreading across the entire state of Michigan. We know our colleagues in other hospitals and health facilities are experiencing the same exponential trend that we are experiencing. And that's quite different from the last time when there were places we could go throughout the state or country for staffing and for availability of services for people. So this means that we have a very little opportunity to share clinical staff or transfer patients. Our first commitment is always to make sure we're caring for our community. That's connected to our mission to improve health, inspire hope, and save lives. And this is what we are committed to do right now. We are also taking significant actions to continue to respond to this crisis. For example, we're expanding our ICU capacity, and we're dedicating more space to care for people with COVID-19. We're also utilizing our full network of locations across our area. And we are starting to defer inpatient surgeries when it requires an overnight stay. And we're moving as much as possible to the outpatient setting, to curbside care, to virtual. Even with these actions, the reality is that Spectrum Health and our hospitals across the state will be hitting their capacity in a matter of days. And so we must change this trajectory of community spread. This is why we need our community's help and support. We need to flatten this curve like we did last spring. You know, there are things we could do back 2 months ago when the positivity rate was at 3% or less. But now that it's much higher, some of those things should be rethought, because it's just, this virus is now invisible and everywhere within our community. And so we need your help to do the things we know work, but some additional things, like not doing some of the social gatherings and being mindful of when we gather without masks on, because this will help us slow the spread of this virus, and it will ensure that we can continue to care for our community in everything that we're trying to do. So I'd like to turn it over to Dr. Daryl Almucci, our president for Spectrum Health West Michigan, to share with you a few of graphs and slides about what we're really seeing here in West Michigan. Daryl?
Thank you very much, Tina. I'd like to share with you a slide about the testing positivity that Tina mentioned, because I think a picture is worth 1,000 words. And in this particular graph, you can see our testing positivity, and you can see that very rapid rise that started occurring just a few weeks ago. And now we are up to about 14%, as Tina mentioned, and we've hit as high as 20%. This varies day by day, but clearly a concerning trend. And why this is so concerning, if we can move to the next slide, is the following. If you look at this slide carefully, the purple line, the purple curve, is the number of positive tests we are seeing. And you can see that it was relatively steady for many months. And then over the last few weeks, we really started to see that number pick up. The green curve is the number of hospitalized patients. And what you see is you see that rapid rise or vertical takeoff of the purple curve of positive tests, and you see that arrow when it began. We have found that about 8 days to 2 weeks after we start seeing increasing positive tests in the community is when we start seeing increasing hospitalizations. And this has us very concerned because right now, as Tina mentioned, we have nearly 300 people, or 8 times as many we did just 2 months ago, in our hospitals with COVID-19. And our testing positivity continues to increase. And that tells us that over the coming weeks, we will see a markedly increased number of patients in our hospitals with COVID-19. And so with that, as Tina mentioned, we're taking many steps to protect our patients, our staff, and the community. First amongst them, which will be enacted tomorrow morning, is we are enhancing visitor restrictions at our inpatient hospitals within West Michigan. This will be different than what we did in the beginning of the pandemic from lessons learned. Essentially, for adult inpatients coming to our ED and in our hospitals, they will not be permitted to have visitors, with exceptions of ICU care, end-of-life care, and other very specific exceptions. And this is to protect the patients, protect visitors, and protect staff. From a testing standpoint, Tina had mentioned that we do upwards of 4,000 tests a day. And as we're having increasing demand with so much positivity and so many people with symptoms in our community, we are prioritizing those with symptoms. And so starting now, we will be prioritizing symptomatic patients for tests in the community, and we will not be performing tests on people solely with exposure. The rationale for this is, number one, we want to make sure those symptomatic patients get tested. And number two, we want to make sure that our testing turnaround times remain short so those tests are actually actionable. I'd like to then turn and say, with all of this, and clearly we're painting for you a picture of significant concern. I'm sure you all saw the news earlier this week about Pfizer's vaccine trial. And I will tell you that here at Spectrum Health, we are not only very hopeful and optimistic about this, but we're undergoing massive amounts of planning, everything from buying freezers that make it to -80, as you've heard, to working with local partners, health departments, other health systems. So we are prepared for distribution, and we are definitely hopeful that come the next month and coming months, we'll be able to help participate in distributing these vaccines as they become available. But we also want to remind everyone that even though a vaccine is on the horizon, it's not there yet. It's not a cure today. It's not going to stop what we're seeing. And so we're really, really emphasizing that everyone needs to do their part. And so some specific information that came out this week I want to share with our viewers is the CDC just yesterday came out advising that for Thanksgiving, a time that we all like to spend with friends and families, their strong advisement is that we all spend Thanksgiving with our immediate households only, our immediate family, and not necessarily with our extended families and friends. I know that will be so hard for everyone, but given what we're seeing here in West Michigan, we are very fearful that if big groups start getting together, the spread will go on even further. So I'm hopeful that everyone will be able to heed that. With that, all the other advice that everyone has given for so long, we're just doubling down on masking, social distancing, hand hygiene, and so forth. And we're hopeful that in the near future, that will all be a thing of the past, but clearly it isn't just yet. With that, I will turn it back to you, Carrie, for questions.
Thank you, Tina, and thank you, Daryl, for that. Just a reminder to the media, please open the chat in the Zoom meeting here to post your questions. Bruce, I will turn it over to you to ask the first question. If you're there, Bruce, otherwise I can take it. All right.
I got it. I'm sorry, Carrie. I was had it on mute so I didn't put any extra noise in this conference. Sorry about that, folks. We do have a question from one of our friends at the Free Press who's asking about our staffing situation and how are we facing the problems or challenges with our own employees contracting the virus and having to be in quarantine. I don't know if we have a specific number available right now, but we can certainly follow up on that. But Tina, is that something you want to talk about, is how we're dealing with this challenge?
So we, every day we ask our team members to let us know how they are doing, and we take a symptom checker, and that identifies people that have symptoms of COVID. And then once they go through that, they do get tested for it. And we are seeing that number increase in terms of the number of employees who have tested positive for COVID. We also do our own contact tracing. So we're seeing that a vast majority of this is coming from outside in our community. And as we look through it, sometimes it's unsure, but most of the time it's from a breakfast here or a family member that lives with them, something like that. And so we are really managing that. This is one of the areas that we are probably the most concerned about. Our team members know how to take care of themselves. They have access to PPE, especially within the organization. And so it can be so easy just to get this virus right now. We are tracking to see how many people are out. What is most critical is looking at where we will need certain team members to care for an increase in COVID-19 patients. And in some cases, this will mean that we are bringing people in to work some extra shifts, bringing people in that typically don't work on a unit but has the skill set to work in that unit to work it there. And we're managing that currently right now. But I know that every organization is looking for people to help with this curve, especially if it continues to increase like we're seeing it right now. Daryl, would you add anything?
I think you covered it quite well. The only addition I see on the end of we increased patient nursing ratios. At this point, we have not. We have all sorts of plans if that ultimately comes to pass, if we start seeing numbers like we may in the coming weeks, but right now we're still sticking to traditional nursing ratios.
Okay, kind of similar. Now we're switching to capacity and bed issues and patient issues, and we have a reporter from MLive who wants to know, how close is when we say we're close to capacity, and have we taken the steps of working with the state on certificate of need for those additional beds we would be putting up if we need them?
Yeah, maybe I'll take that one, Bruce. So we are definitely close to traditional capacity. I want to emphasize traditional because Tina had mentioned how we've converted other floors to COVID units, converted rooms that weren't ICU rooms to ICU rooms. And as we've learned from hospitals in Detroit and New York early in the pandemic, that you can absolutely expand capacity if you truly need this. So we are in the process of doing that. We have applied to the state, and we really thank the state for the way they've approached this, and we at present are still have room. However, that room is relatively limited.
Okay, thank you, Doctor. One question we have from Bridge Magazine has to do with our change in testing for people who are only symptomatic. With people wanting to get together for the holidays, do we have any advice for those who are not symptomatic but want to get tested, or what maybe we can talk about what extra precautions are necessary?
Yeah, maybe I'll take that one too. First I'll say, quite honestly, I think the rule here really should be we shouldn't get together outside of our household at the holidays if we possibly can avoid it. I don't have a specific answer. I know there are multiple testing locations in West Michigan. With that said, we've been providing a very large number of tests. And again, we're not trying to specifically exclude anyone. It's just that the number of people with symptoms for COVID-19 is so high right now. We want to make sure that we prioritize those. If that number starts coming down and we're able to expand again to asymptomatic testing, we absolutely will. We're just unable to do that now.
All right, Daryl and Tina, there's a question from WGBU Radio. They're remembering that the state had a regional approach for phases in reopening and a positivity rate of 4% as a baseline. What became of that, and are we familiar with any bar the health department or the state is using from a baseline perspective?
Yeah, so we're actively talking with the health department, as with the state and many others in our community. What we've seen, especially right now, is the spread is occurring in the community. It doesn't seem to be spreading in schools. It's not spreading in businesses where the precautions are in place. And so that's the difference from what it was like in the spring and when some of those things were put in place before. Now, it's still 4% is what we're seeing when it starts to bend that, run that curve and then start to escalate pretty quickly. And so that's where we look at it to say, where is it spreading? How is it spreading? And are there certain measures we can take to stop that? What we're seeing is in the community, and that's why we're continuing to talk about the areas that we know work: masking, social distancing, and the gatherings are a key area. Even if it's a small gathering, it's a key reason for the spread that's coming forward. And we're particularly concerned because of the holidays coming up, which is why Daryl mentioned the CDC guidelines.
Okay, the Detroit News is asking about a question having to do with testing and our testing supplies, since we are going to focus now on patients that are people that are symptomatic. What is our confidence level, and how do we feel about the supplies we have now that we're making the switch for those that need it?
Yeah, so, the supply chain for testing, as I think everyone's aware across the country, across the world, has been very limited. We thankfully have actually done a pretty amazing job at acquiring supplies, primarily because we use multiple different platforms to do our tests. With that said, we're very mindful that the supply is constrained. And so one of the things we'd like to be able to do over time is even expand further beyond the 4,000 a day. Based on supplies, we can't do that just yet. And we do not believe we will hit capacity. We think we'll have enough supplies for the coming weeks for sure, but we're very mindful of it.
Thank you, Daryl. I'm going to go, the next two questions have a similar theme. So we're talking about, and I think you actually touched on this earlier, but just to reiterate it a bit, questions again about, are we looking to add beds? And I think the other question is, Tina, to your point, if we're going to hit capacity, give some context to what does that mean and what happens when we reach capacity. Maybe give some context to that. Tina, I could start with you, and then Daryl, you could add in from there.
So as we said, we are modeling this in every which way, and I feel really confident with the models that our team has been able to put together and a lot of learnings that we've had over this time period. What we look at is both the bed capacity, but also staffing capacity, and then we also take into account length of stay, how long people are staying in, and if we're able to discharge patients to their home or to another setting. And so all of that factors into this modeling that we have. As Daryl mentioned, we're seeing that in the projections, we will hit some of the traditional capacity constraints that we have. And so we're taking proactive action to expand into other areas to make sure that we have that room. It's our preference that we continue to care for our community for not just COVID-19, but for other needs within the four walls of all of our facilities and in partnering with everybody else, especially in West Michigan. And so that's our first step, is to make sure we're doing that. So we're being very creative and innovative to find those ways to ensure that we can take care of people here before we need to expand outside. And I think that that's our first focus, because we know that the care we can provide there is still high quality in the process. Daryl, would you add anything?
No, I think you covered it, other than I do see a number of questions talking about the possibility of what's called an alternative care site, which I think we heard a lot about early on, and this would be like Cobo Hall in Detroit. We are in active discussions with local and state officials about the possibility of different alternative care sites. What we've learned from other places that saw very large surges like Detroit, New York, is that those are very rarely used. You should try to use your internal capacity and maximize, as Tina said, first, but we absolutely are in conversations. The biggest limitation for that, to be very honest, across the country, and definitely here, would be staffing. Even if we had another site with hundreds of beds available, staffing will absolutely be an issue if we got to that point.
So to piggyback, sorry, Bruce, I know we're trying to get through all these questions, but to kind of piggyback on that thought, there is a question in here about from Michigan Radio about contract workers. If there is issues with staffing, is that a possibility for Spectrum Health, and how likely or unlikely is that?
I'll answer that one. And we've just talked about it as recently as this morning. Possibility, yes. Likely is very low for the sole reason that there are so many hotspots across the country right now, even across the state, that essentially everyone would be competing for a very limited pool of extra staff. And so that will be a big challenge. And that's something, in speaking with leaders across the state in healthcare settings, all are fearing the same, that there really aren't extra staff to go around beyond our own team members.
We have a question from Channel 17 about asking, with the surge and everything, are we asking people to defer regular doctor visits or screenings? And I think we've said a lot about on that lately. Dr. Elmucci, you want to expand on that?
Yeah, so this is very, very important. And actually, I'm a cardiologist, so it's near and dear to my heart, no pun intended. What we learned in the beginning from the pandemic with essentially shutting down everything, and this was really across the country in terms of care, was that a lot of that care that we thought was elective, once it's delayed more than a few days or a few weeks, can lead to harm if it's not given. So our sincere goal is to keep as much care going as possible, particularly in the outpatient setting. We no longer have concerns over PPE supplies, so we can protect our patients, protect our visitors, and protect our staff. The goal would be to keep doctors' visits and traditional visits going, outpatient surgeries and so forth. It's really in the hospital setting that we're trying to make availability of beds and making changes, as Tina mentioned. The only caveat to all that will obviously be over time. If we need to move physicians or nurses or other staff from the outpatient setting to the hospitals to take care of more patients, we would potentially have to adjust a bit. But otherwise, our goal, and I know that all the other health systems in the state's goal, is to keep as much care going so we don't cause harm down the road.
So there's a question from Rapid Growth Media. Initially in the pandemic, we saw a highly numbers that showed the disproportionate impact on our underserved communities. What kind of data are we seeing now? Tina, do you want to take that, or should I?
Go ahead, Daryl.
Great. So that's a great question. And clearly in the beginning of the pandemic, particularly in areas like Detroit, New York City, New Orleans, we saw a really disproportionate impact on underrepresented communities. Thankfully, and we follow this data very closely, over the last few months within West Michigan, we've seen the number of COVID patients coming to the hospital and the number of patients with COVID-19 who died. Essentially, those numbers are very representative of the numbers in the community of different races and ethnicities. So we are not seeing disparities or high numbers of African-American, Black, Hispanic, and other underrepresented minorities in our hospitals or dying. And so we're very thankful to all the outreach efforts that so many have made to really educate communities, help with testing, help with prevention, and so forth.
Maybe you can answer this question. A reporter from WHTC Radio in Holland is asking about, with the pandemic and the number of patients we've seen since the spring, will this change our numbers and the amount that we've provided for uncompensated care?
Yeah, we, in our modeling, based on what we saw in the beginning, based on the number of people that are unemployed in the state, shifts of insurers and so forth, we absolutely are seeing more of that now, and we predict more of that in the coming year, as does essentially every health system in the country.
Let's take a question about vaccines from WWMT. How are we working to plan for the vaccine potentially coming to market? There's a question about freezers in our system. How many do we hope to have? Can we talk at all about any preparation that Spectrum Health may have taken so far?
Sure, maybe I'll take that one too if Tina doesn't mind. So we, about 8 weeks ago, created a task force internally to focus on vaccines, knowing that there were many unknowns, but we were very hopeful that one or more vaccines would come. This is a multidisciplinary task force with clinicians, with operations folks, with supply chain, And this task force has been meeting regularly. We have purchased freezers, as I mentioned, all sorts of other supplies in anticipation of different vaccines, knowing there'll probably be many. We are working with all the health departments that are in our service area. We are working with all the other health systems in our service area. And our goal would be to have distribution ready as soon as vaccines are available. I want to remind everyone that there are going to likely be very strict recommendations from the FDA in terms of prioritizing who gets vaccines first. We haven't seen the final for that, but we're also working on that as well to be able to try to prepare for our own workers as well as the whole community.
Hey, another question about the vaccine and storage. A reporter from Channel 3 is asking, do we have all those plans nailed down as far as how many freezers we're going to need, cost, and where they're going to be? Either one of you?
So we, first of all, I will say that, we don't know how many of the vaccines that will come will be minus 80 degrees. These mRNA vaccines, like the Pfizer vaccine, like the potential Moderna vaccine, require very cold storage. Many of the others require just regular storage. With that said, we have prepared in ordering freezers and that type of material for what essentially is a lot of really cold vaccine. And we feel quite confident that we have a great plan for this. With that said, time will tell what ultimately gets approved by the FDA and when.
So Tina, question for you from Julie Mack with MLive. Are hospitals talking to public health officials about shutting down restaurants, bars, or other kinds of shutdowns? Maybe just talk a little bit about how we work with the state.
Yeah, so we work regularly with the health department and the state to talk about what's going on. How can we help each other? Some of those decisions are clearly the health department or the state's decision to determine. But what we're really trying to focus on, what are the ways that we as healthcare professionals, as physicians, as nurses and other caregivers provide advice to others to help reduce the risk of COVID-19 and protect our community.
That's great, thank you. I know we're very close to time here. So one question and a theme I'm seeing in some of these questions is what can the public do to help? And maybe you both could answer that. What would your message be to the public on how can they help?
So the first step is be mindful of what you're doing. We're asking you to always wear a mask, wash your hands, be social distant. Some of the simple things that we were able to do when we were outside, when the positivity rate was 3% or less, we just can't do those right now. And what we want to do is we want to flatten the curve. We want to get through this time period, and we know the positivity rate will come down. So it's taking this time period for the foreseeable next few weeks, just evaluating, is it worth the risk? How can you help contribute to all of us in this community to try to drive this positivity rate down and maybe delay those social gatherings that you've been looking forward to a few more weeks so we can get the positivity rate down and flatten the curve for our organization and our community.
Daryl, do you want anything to add?
Yeah, I would just emphasize that ultimately we're not talking about months and months of us not leaving our home. The goal would be that everybody does their part for a matter of weeks. This starts coming down, and then hopefully we can all do a bit more again. But this is very serious, and we have been in contact with every single hospital in our region, and everyone is feeling it the same way. And we are getting to a point where if we don't have the public helping us, you're going to see a lot more patients in the hospital, a lot more patients die, and it will not be a pleasant sight. So I'm very hopeful that everyone will heed this warning.
Great. Well, thank you. Thank you, Tina and Daryl, Dr. El-Mucci, for sharing your comments this afternoon. And thank you to all the media for joining us, and especially for our first COVID-19 briefing. We do have plans to do these on a regular cadence. But if you did have questions that we weren't able to get to this afternoon in our allotted time, please reach out to the PR team to follow up on those questions, and we will get back to you on those. So with that being said, I appreciate everybody's time this afternoon, and take care and be safe.